Good afternoon, everyone. My name is Joshua Berry, and I'm an analyst of health promotion and disease prevention at ASTO, the Association of State and Territorial Health Officials. I'm honored to welcome you to this webinar on behalf of the Tobacco Control Network. I'm looking forward to the rich information being shared on today's webinar, How States Can Amplify Tobacco Industry Corrective Statements. Before we jump in, I'd like to overview the logistics for this afternoon's webinar. You have the option of listening to this webinar through your computer speakers, which is the preferred method, or over the phone through the toll-free number and passcode shown on your screen. Please do not use both methods. This webinar is currently being recorded, and a link to the recording and webinar slides will be sent to you via email this week as soon as the recording is available, and the recording and webinar slides will also be posted on the ASTO and Tobacco Control Network websites in approximately 2 weeks. We invite you to participate in this afternoon's question and answer session by typing your questions into the on-screen chat box at any time during the webinar. Computer and phone lines will be muted for the duration of today's webinar. As you can see, we have a full agenda to cover, which will allow us to learn more about the tobacco industry corrective statements from national tobacco control partners and also get a state-specific perspective from public health practitioners using the corrective statements to advance tobacco-free messaging. We'll start with a brief overview of ASTO and the Tobacco Control Network. ASTO, the Association of State and Territorial Health Officials, is the national nonprofit organization representing public health agencies in the United States, the U.S. territories, and the District of Columbia, and over 100,000 public health professionals that these agencies employ. The Tobacco Control Network, or TCN, which is an ASTO peer network, is comprised of tobacco control program managers at the state level, additional tobacco control programs at the state level, such as the Funders Alliance, and additional tobacco control staff from each state, territory, and the District of Columbia. The partnership between ASTO and TCN provides a valuable linkage to tobacco programs across the nation and assists ASTO in achieving the goals of tobacco prevention and control with an accurate state-level perspective. TCN established its current 2016 through 2019 strategic map to help achieve its mission of improving the public's health by advancing state and territorial tobacco prevention and control. Current priorities include engaging TCN members in the future of TCN, supporting Tobacco Control Network funding alongside national partners, and keeping pace with environmental challenges in the tobacco use landscape, with an overarching principle of incorporating health equity in all of TCN's work. The TCN Executive Committee includes a diverse representation of state-level tobacco control stakeholders from across the U.S. and territories, from Rhode Island to Hawaii. This allows the Executive Committee to represent TCN members working in tobacco control from throughout the United States. It's now time to give the floor to the speakers that we have joining us today. Presenting first is Desmond Jenson. Desmond is staff attorney at the Public Health Law Center, focusing on federal regulation of tobacco products. He works closely with public health leaders to keep them apprised of important regulatory changes, litigation, and other opportunities to strengthen federal regulation. Desmond, thanks so much for joining us.
Thanks, Josh. I'm very excited to discuss the legal background of the U.S. versus Philip Morris, which is really one of my all-time favorite topics. I find that it actually helps me to understand the case better if I think about the historical context of how the case came to be and how it's progressed over the years. And because of time constraints, I'm just going to jump right to 1994, where there were a confluence of events that really accelerated the tobacco control movement. So that year, the FDA publicly announced its intention to regulate cigarettes and smokeless tobacco. Several news agencies published extensive exposés. Whistleblowers came forward with millions of pages of documents and personal accounts of the industry's nefarious business practices. There was a series of hearings that were conducted by a House subcommittee chaired by Henry Waxman. And the states of Mississippi, Minnesota, and West Virginia all filed lawsuits against cigarette manufacturers seeking compensation for the payments that the states made into the Medicare and Medicaid systems to treat tobacco-caused illness. Eventually, 42 states filed lawsuits against cigarette manufacturers, and 4 of those states, Florida, Minnesota, Mississippi, and Texas, settled their cases with cigarette companies, forcing the industry to discontinue certain business practices and to pay the states compensation. The other 46 states collectively settled in a settlement known as the Master Settlement Agreement, which probably most of you know, Similar to the individual state settlements, it puts an end to certain business practices, and it forces the industry to pay compensation. Now, I highlight the MSA before we talk about the U.S. versus Philip Morris because it's a really important immediate precursor to that lawsuit. So the MSA was executed in 1998, and this case was filed in 1999. And just like the state cases, this case began its life as a Medicare compensation case. When the case was filed in 1999, the government had 4 theories as to why the tobacco industry owed it compensation. We call these causes of action. As you can see, 2 of the government's 4 claims are related to the recovery of medical costs. And as sexy as the secondary payer provisions of Medicare are, we're not actually going to talk about them because the medical reimbursement claims were actually dismissed. However, the government won on its 2 other claims, both related to the Racketeer Influenced and Corrupt Organizations Act, or RICO. You may have heard of RICO in a movie or a TV show about the mafia because the original purpose of RICO was to give the federal government a new tool to combat the mafia and other forms of organized crime. So, let's talk about RICO. RICO is about racketeering activity that furthers an enterprise. The enterprise is an association of people, companies, or groups, and it can be formal or informal. Racketeering activity is the commission of specific acts that violate a host of federal laws. These violations are referred to as predicate racketeering acts because in order for a court to find that you violated RICO, the court must find that you violated one of these other acts. RICO lists several predicate acts, including violent crimes like murder, kidnapping, arson, and robbery, as well as other crimes like extortion and trafficking in drugs. RICO also lists federal law violations like wire fraud, mail fraud, counterfeiting money, and witness tampering. And then some of the most serious offenses relate to human trafficking and making or selling chemical, biological, or nuclear weapons. So if you put those 2 pieces together, just because you've committed wire fraud or sold biological weapons doesn't necessarily mean that you violated RICO. So under Section 1962C, it's a violation of RICO for any person who's associated with an enterprise to conduct that enterprise's affairs through a pattern of racketeering activity. So a pattern of racketeering activity is the commission of 2 or more of those predicate racketeering acts within 10 years of one another. The judge in this case found that the predicate racketeering acts were wire fraud and mail fraud, and the decision makes clear that all of the defendant tobacco companies committed at least 2 predicate racketeering acts within 10 years of each other. So the other cause of action in this case under 1962D actually establishes that it's a separate violation of RICO for any person to conspire to violate any of the other provisions of RICO. And the court found that the tobacco companies had conspired to violate 1962C, which was the previous section. In the law, a conspiracy is when 2 or more people come together to agree to do something. So the court found that the defendants knowingly agreed to the commission of 2 or more of the predicate racketeering acts. And the court notes that that conspiracy began in December of 1953, when the cigarette companies first came together to create the Council for Tobacco Research. Obviously, we don't have time to walk through the entire case, so I'll just highlight a couple of important events. Again, the case was filed on September 22nd of 1999 while Janet Reno was still Attorney General. On July 7, 2005, several public health groups intervened to actually become parties to the litigation, which is very important. On August 17, 2006, Judge Kessler issued her ruling finding that the tobacco companies had violated RICO and imposed several remedies on the industry. But of course, the industry appealed that decision, and on May 22, 2009, the Court of Appeals upheld the finding and ordered some slight modifications to the remedies. And then on June 28, 2010, the U.S. Supreme Court declined to hear the case, so that made the industry's appeal. They declined to hear the industry's appeal, which made the case final. And of course, that wasn't the end because the industry's been attempting to erode the scope of the remedies since that decision was final. And then just last year, on November 26th, the first corrective statements were finally published, but the case is not yet over. So the 2006 opinion is huge in every sense of the word. Judge Kessler outlined the tobacco industry's business practices that violated RICO from the 1950s to the present. The opinion relies heavily on millions of pages of internal tobacco industry documents. That's the slip opinion version on my bookshelf. It's 1,600 pages long. It takes up 2 binders, obviously. And that's just how much paper it takes to fully document the tobacco industry's business practices that violate RICO. We actually have a publication that we're very proud of called The Verdict Is In. In fact, attorneys at the Justice Department have told us that they really love it. We took that 2006 opinion and tried to make it usable. So we pulled out all of the quotations that we thought were the most useful and described the most egregious tobacco industry behavior. And if you look through that, for each quotation, there's an endnote that lists the Bates number for the document that the quotation comes from. So if you take that Bates number to the Truth Tobacco Industry Documents database at UCSF and you search for it, you'll find the entire document that quotation comes from. So we've heard from a lot of advocates that that's a really useful feature. Okay, so the court found that the defendants had violated RICO, and normally if you violate federal law, there's consequences. We call those consequences remedies. And originally the government was seeking 10 different remedies. The government wanted the court to force the industry to stop using some specific terms like light, to disseminate corrective statements, which we're talking about today, to disclose more of its secret documents and to maintain the document depositories that were already created, to enjoin the industry from committing future violations of RICO, to pay for the litigation, to relieve the industry of its ill-gotten gains, specifically $280 billion, to create a national smoking cessation program, to establish youth smoking reduction targets, to make structural changes to the companies by appointing a tobacco czar, and to create a public education campaign targeting youth. And unfortunately, the court did not impose all of those remedies. Disgorgement of profits was taken off the table very early on. The industry successfully argued to the Court of Appeals that all the remedies under RICO have to be forward-looking with the goal of preventing and restraining future RICO violations. So disgorgement is actually a backward-looking remedy, the court found. And Judge Kessler was sort of bound by that decision. So when the 2006 opinion came out, it didn't impose the National Smoking Cessation Program, the youth reduction targets, and the public education counter-marketing campaigns, because those remedies were either not forward-looking or they weren't narrowly tailored to prevent RICO violations. George Kessler also ruled that making the corporate structural changes was actually an unconstitutional delegation of judicial powers to non-judicial personnel. Judge Kessler did impose the other remedies, including requiring that the defendants pay for the cost of the litigation, which last I checked was now more than $10 million. So let's talk about the actual corrective statements. The court ordered the industry to make statements related to 5 topics. They're all topics that the court found that the industry had made deceptive statements about in the past. We don't have time to run through all of the individual statements, but these are just the broad categories. I will note for you that since about 2010, the litigation has almost solely been focused on this particular remedy, how it would be implemented, and what some of the language would be. So just to show you an example, originally each statement in each broad category was going to be prefaced by this statement before you actually get to the hard-hitting facts. This talks about industry deception before introducing the truth. And unfortunately, that language was stripped out, and you're left with a more benign warning that also tells you that you're about to hear some truthful statements. And then eventually, you can't actually even use the word truth in the preamble, which is incredibly unfortunate. So here's one full example of one set of the statements. These are for the adverse health effects of smoking. Now, obviously, for all of you, none of these statements are news, but to people who don't work in tobacco control, these are shocking truths to hear for the first time. I know Becky is going to run through some of the details of where and when to see the statements, but these are currently on TV and in newspapers, and hopefully very soon they will also be on cigarette pack inserts and also on tobacco company websites. So that's it for me. If you have questions in the future about litigation or the remedies, in the short term or the long term, obviously always feel free to reach out. This is a case I pay close attention to, and I'm always happy to answer questions. So I'll turn it back over to Josh.
Terrific. Yeah, thanks so much, Desmond, for getting us started with that important and detailed legal background. So as you alluded to, presenting next is Becky Wexler, who's the Director of Media Relations at the Campaign for Tobacco-Free Kids. And prior to working for TFK, Becky managed IQ's Solutions communications contract with the FDA Center for Tobacco Products. So thank you so much, Becky, for joining us this afternoon. I'm going to turn the floor over to you.
Sure, thanks for having me. So I'm going to go over, as Desmond said, a little bit more of the details of where the corrective statements have already run and where they will continue to run, and how you all can help both amplify what's actually in the statements and use them to your own advantage to try to advocate for policies that you're pushing for in your state or locality. So this all sort of, after all of the years of legal battles, we finally started to see the corrective statements come out to the public in late November. So it was right after Thanksgiving when both the corrective statements started running in television, in newspapers, and then, as Desmond mentioned, there's still a legal battle over how and when and where the corrective statements themselves need to appear on the tobacco companies' corporate websites, and that would be on all of their sub-websites and their brand websites, and so that's still being worked out. And then the actual how the corrective statements will appear in and on the actual packs as onserts, and that's still being litigated. And then what's going to happen at the point of sale, where tobacco products are sold, is something else that's a little bit further down the line. So let me go over a little bit about newspapers. So in the court order, there are about 50 newspapers specified in there that have to run their corrective statements. And the way it works is that there are 5 for each of the corrective statements. Each has to run on as you see in the slide, basically the first Sunday, except for November, of the month. And it has to be a full-page ad. And in November, it was the one that we saw that Desmond showed with adverse effects of smoking, and we have seen the addictiveness one, the light, low, and mild, and then coming up just next weekend, we'll see the second to last one on the fact that tobacco companies actually manipulate their products to ensure that they cause the most, that they cause nicotine delivery and get you addicted. And then March will be the final one. So the papers that they're running in, it's a mix. There's a lot of national papers, New York Times, Wall Street Journal, USA Today, several regional papers as well, and I'll show you later on in the presentation. We have a place on our website where we do list all of the papers that they're running in. There's also a handful of Spanish language papers and African American community papers that the ads are running in. I'm calling them ads, but corrective statements are running in as well. And they're in Spanish on the Spanish language papers, and we have those. We do have the ads, the corrective statements translated into Spanish on our website as well. So this is how it looked. This is the November ad, but it's pretty. I don't know if anyone's seen it, but it's a pretty stark looking statement, and it's all black and white, and it takes up a full page. So it's supposed to be in the A section, and it takes up a lot of real estate. So hopefully it's noticeable. Now on TV, we didn't show what the ads actually looked like, but it's very similar to the newspaper ads. It's just black text on a white background, and it is a voiceover. So no bells and whistles, nothing more than that. And the tobacco companies had to do an ad buy that would result in the ads running 5 times a week for a year, and they started again in November. And that will be for a total of 260 spots, and they have to run in prime time on the major networks or on a network that has an equivalent audience share. And I haven't seen the most recent buys, but we've been kept in the loop on most of them, and the ads are running on, I think it's mostly on CBS and NBC programs. I have not seen one personally, but I know that they're airing. So here is the site where, and Josh is going to make the slides available for you, but on our website, this is a landing page for all of our resources that we have for you all, which I'll be going through soon. And on that, in that spot, there is a link to the ads, and so you can use them. It's somehow, I think, easier. This is not my area of expertise, but to extract the actual video files from the YouTube channel. So I've given that link as well. And you can feel free to do whatever you want with them, make fun of them, promote them. We'll hear from Minnesota how they're using them. So there's lots you can do with them. I just wanted to go over a little bit of our just to show you our focus on on what we want you all to do to try to amplify the statements, and why you'll see the end result of the creative that we've made for you all, and the messaging that we're using. So I've talked about this a little bit, but the fact that the corrective statements are not running that much on TV, I mean, that's 260 ads in a year is not that many, and they're not running in every paper, certainly, by any means. So we just want to get more eyes on the corrective statements themselves, because, as we all know, this is not new news, but some people don't realize many of these things, that cigarettes are actually designed to be harmful. And another reason to amplify the statements is to remind anyone who's paying attention that this is not something that was the result of a settlement. This is actually something that the tobacco companies are being forced to do by a federal court, and they drag their feet for all these years. And then lately, you've probably seen in the news that certain companies like Philip Morris has launched this Foundation for a Smoke-Free World, and many companies are saying that they're shifting towards harm reduction. This case is a good reminder that for years and years, they were not actually, they were saying that they've changed, but they were not, and they were guilty of racketeering. And then, as I've mentioned, you can use the corrective statements and the fact that they are now being forced to publish them as a hook for your local policy goal, whether it's Tobacco 21 or tax increase or anything, really. So I won't read all these, but I've talked a lot about these. So these are the key messages that we've pulled out, and you're free to use them in any way you want, or not at all if you don't need to. But this will sort of give you the frame for how we've created our resource materials. We're talking about, and I said this, the fact this is a court-ordered thing. This is not like a settlement. And we've been actually trying to correct any media that reports on this case as a settlement, because that's not what it was. This is a punishment and a remedy. And then the fact that the tobacco companies kept fighting, and they even fought over as Desmond said, the "here is the truth" language, and they continue to fight in court about the pack inserts and the font size, that things have to appear on websites, and really every little thing, and just shows that history repeats itself. And again, I mentioned Philip Morris and the Foundation for the Smoke-Free World. And then I'm focusing on the second bullet point here, but we've been thinking about trying to frame this as needing more than corrective statements, but also corrective action from the tobacco companies. And if they keep marketing cigarettes, then they're not putting their money where their mouth is. They want to sell more cigarettes, or they want to save lives. They can't have both. So we have suggested that you could do the following. You could do many other things as well. We have a press release template on our website that's downloadable that you can customize to highlight your own policy goals. You can promote our social media graphics on your own social media channels. You can pitch the story of the corrective statements to your own media if it hasn't been covered. It has received a fair amount of coverage, but I still have seen many op-eds and just coverage of the story in general. So I don't think and the fact that it's still running in newspapers gives you, at least for the next couple of months, a hook on the first Sunday of the month. And then a letter to the editor or an op-ed is another way to highlight a specific policy goal you're working on. So we have, again, on that same URL that I showed before, we have all the shareable graphics. We've been using the hashtag tobacco racketeers, and I just checked before this call, and it's definitely still being used by partners and others on Twitter. So please continue to use that. And then if you have relationships with policymakers or other coalitions or groups, please pass these along. We want the most eyes on them that we can get. So this is an example. We have more than I'm showing you, but these are some of the graphics that we've created that you can share. So this obviously is a picture of the tobacco executive saying, I'm telling the truth, tobacco does not cause cancer. So we sort of doctored that a little bit. And then we have a series of these definition social media graphics that we've used kids behind the racketeer and liar and a couple of others. This one talks about racketeers. And then we've created a couple of graphics that highlight some of the findings or some of what's in Judge Kessler's ruling, and just pulling out some of the really stark findings that the tobacco companies are liars and they targeted kids, and they knew how bad smoking was for health. And here's another one similar to that. This is pulling out actually what's in one of the corrective statements. So this is the landing page that I've referenced a couple of times in here, and we have on here, you can't see the whole thing, but we have all of the things I've mentioned, the social media graphics, the press release template, lots of history about the case, the link to the actual opinion if you should want to read 1,600 pages, and then we also have a detailed list of which papers the corrective statements are running in. We have the links to the video, to the actual ads themselves. We have the statements translated into Spanish, and just lots of other resources. So please take a look and definitely get in touch if you don't see something you need or you can't. I've had some questions about how to actually extract the files, the video files for your own use, and I've been able to troubleshoot some of that by working with my colleagues, so feel free to reach out on that. So I think that is it. I think I went under my 10 minutes maybe. Happy to answer questions at the end.
Yeah, thanks so much, Becky. Yeah, your timing was excellent. Thanks so much for the logistical overview of the corrective statements, and also for sharing all the resources that are available to tobacco control stakeholders. Next, I'm happy to introduce Doug Matheny, the Programs and Initiatives Manager for the Policy Division of the Oklahoma Tobacco Research Center. Doug retired from the Oklahoma State Department of Health in 2011 after 28 years of service, including 16 years as Chief of the Tobacco Use Prevention Service. Doug is also a past chair of the Tobacco Control Network. So Doug, thanks for rejoining us at the TCN. The floor is all yours.
Thanks, Josh. I'm excited to share some data and observations from a recent national survey relevant to the corrective statements. I wanted to start with some background information. We know from internal tobacco industry documents that tobacco companies have not only deliberately misled the public, they've also deliberately misled policymakers. And this is the key point because we know that tobacco control policy measures are the most effective way to reduce smoking. The tobacco companies know that too, of course. In fact, by 1997, the internal documents show that tobacco companies had helped to defeat, actually had led the effort to defeat, separately and in all 50 states, bills that would have restricted smoking in workplaces, raised the price of tobacco product, limited marketing of tobacco products, made it harder for you to buy tobacco, and 5 advanced tobacco control programs or research. So all 5 of these major tobacco control policy areas, they have affected for many years. And when, of course, outright defeat could not be achieved, the companies have sought to delay or weaken such measures. The internal documents show that they've even often drafted the final language for much of the tobacco control policy still in effect in some states. According to public records, in all 50 states today, at least one lobbyist is currently representing a major U.S. tobacco company included in the racketeering verdict. So as the court concluded, they are in a position to continue their misleading behavior. So the survey was conducted in May of 2017. It was just a cross-sectional survey. It's kind of a snapshot. We split the sample in half, and half the respondents were randomly assigned to express their opinions or attitudes before exposure to the corrective statements and related court findings, and half after. We used aided recall to assess baseline awareness of each of the 18 bullet point facts within the corrective statements and 10 related court findings. So the results from the general population sample were that even with the aided recall survey design, less than half the respondents reported being aware of 6 of the 18 bullet point facts and 8 of the 10 court findings. And we'll go through these real quickly in a moment. We also learned that greater public awareness of the corrective statements and court findings will likely increase overall public support for certain tobacco control policies and increase the intensity of support for other tobacco control policies. And finally, that exposure to the statements and findings will likely reduce the extent to which the public thinks lawmakers should trust tobacco companies or tobacco company lobbyists. So let's take a quick look at the awareness data here, just very, very quickly again. The first set of bullet points here is from the first set of corrective statements on the health effects of smoking. 2 of these 4 bullet point facts had less than half of the population responding that they were aware of this information. And even in these where the numbers are higher, there are still significant proportions that were not aware of the information. The second set, none were below 50%, but again, there were still substantial proportions that were not aware. On the third set here, having to do with low tar and light cigarettes, 1 fell below the 50% threshold, but again, all 3 of these had, especially that first one, had significant proportions that were not aware of this information. This fourth set, there were 2 of the 3 that fell below 50%, and the third at about 57%, not aware of the information. And finally, the fifth set, dealing with health effects of secondhand smoke, 1 fell below the 50% threshold, and the other 3, again, still had significant proportions of the public not aware of the information. And we would hope that all the public would be aware of the information, certainly around such an important issue. So we also tested, as I mentioned, awareness of the federal court findings that led to the corrective statements being required. So I've listed these in order of awareness from low to high. And the first finding we tested, or the one that had the least awareness levels, was actually violating the fact that they violated civil racketeering laws, were engaged in an organized conspiracy to commit fraud. Only 23% of the public said that they were aware of that, followed by the finding that they committed fraud and finding that they are likely to continue to commit fraud. And from there, it increases on these next 3, still below 50%. Then finally, these are the last 4 of the 10 that we tested, and 2 of them were just under 50%. The highest is about 55%. So looking quickly at some of the attitude data, and again, I'm just showing a few highlights from this. I wanted to show this one because it deals with the issue of trust. The question we ask is if lawmakers should trust tobacco companies as much as they trust other companies. And we found that those that were exposed to the statements and findings were more likely to disagree with that statement. It was a small but significant difference in the results there. The second one here, dealing with trust, lawmakers should trust tobacco company lobbyists to provide accurate information on tobacco issues, was another one that we saw a small but significant difference from that single exposure to the corrective statements and court findings. This question was, do you think tobacco companies are now taking responsibility for the harm caused by smoking? In this case, the results were not statistically significant, but you can see that there was a trend where the numbers were a little higher for those that were exposed to the statements and findings for those that answered no to that question. This was typical of a lot of the questions on our survey not reaching statistical significance, but trending upwards after that single exposure to the corrective statements and court findings. The rest of these, I'm just going to show you the baseline data before exposure, just to kind of give you a sense of some of the other data that we tested. We looked at potential tobacco industry influences. We found that even at baseline before exposure, the numbers are very high for lawmakers rejecting potential tobacco industry influences. We ask a question dealing with if a tobacco-related law was written or influenced by a tobacco company or tobacco company lobbyists, what do you think lawmakers should do? We found that about 2 out of 3 answered by either choosing the response revise the law or the response remove the law and start over. Only 5% responded choosing the response of leaving the law as it is. This is particularly relevant to the preemption issue as a prime example of language that's still in the books today in many states that was written by the tobacco companies as claimed in their internal documents. And Speaking of preemption, this question asks, in general, which of the following types of lawmakers do you think are least likely to be influenced by tobacco company lobbyists? And respondents overwhelmingly selected local level lawmakers as least likely, followed by national level lawmakers and then state level lawmakers. And this is consistent again with internal documents, the perception of tobacco companies and their lobbyists in how difficult it is to work at the local level, for them to get their way at the local level. So the major conclusions of the survey, first dealing with awareness. We know that large proportions of U.S. adults are unaware of many of the corrective statements and court findings, and that awareness is lowest for the racketeering verdict itself. Regarding attitudes, we learned that strong majorities of U.S. adults think lawmakers should reject potential tobacco company influences and take corrective action to remedy past influences. A couple of limitations. On the awareness questions, we did use aided recall, which can cause reported awareness levels to be artificially high. We think that if we had used unaided recall measures, such as open-ended questions, we would have likely seen lower reported awareness levels. Regarding the attitudes, the survey measured the effects of a single exposure to the corrective statements and court findings. Additional research is needed to determine how multiple exposures might affect attitudes over time. So just some observations here on potential opportunities for public health practitioners. First, as Becky mentioned, the reach and frequency of the ads themselves is very limited, so it'll be important to supplement the corrective statements with educational campaigns. And it seems particularly important to emphasize key court findings, such as the racketeering verdict itself, fraud and likely to continue to commit fraud, because that seems to be what people are least aware of, and perhaps some of the most compelling information that can be shared as well. This can, of course, can be done through earned media, through owned media, or social media, and through paid media as funds allow. Secondly, a major opportunity in the area of policy to expose and denormalize tobacco industry influences. Emphasizing the racketeering verdict and talking points and the rationale for all tobacco control policy initiatives. Provide lawmakers with survey results on attitudes towards tobacco industry influences, such as these survey results or surveys that you may conduct in your own state. Provide lawmakers with relevant state-specific quotes from internal industry documents. And potentially encouraging the introduction of resolutions, even just non-binding resolutions, to raise awareness among lawmakers and public. Even if those resolutions are not formally adopted, they will perhaps be useful as a tool to raise awareness and gain media attention. Here's an example of a resolution recently adopted by the American Medical Association. I've highlighted in red some of the key language, really pretty strong language, calling on the AMA to collaborate with their state and local societies, to work with other public health organizations to educate the public and policymakers about tobacco companies' organized conspiracy to commit fraud leading to the RICO verdict. And then secondly, to work with public health organizations to identify public policies that may have been directly or indirectly influenced by tobacco companies or their lobbyists, and encourage lawmakers to remediate all such influences, to reject any potential tobacco industry influences in the future, and to formally censure the tobacco companies for their fraudulent and harmful behavior. And a resolution like this could potentially be adopted by or introduced in a legislature, in a city council, or a nonprofit organization, medical groups such as the local chapters of the AMA in your state. For additional information, we do have a one-page executive summary and a 10-page preliminary report of the data that I went through today real quickly. And feel free to call me if I can help with anything. Thank you.
Excellent. Thanks so much, Doug, for those research insights from Oklahoma. And to round out our speaker lineup this afternoon, on behalf of Minnesotans for a Smoke-Free Generation, we have Andrea Mowery. As Vice President of ClearWay, Minnesota, Andrea oversees strategic planning, communications, public affairs, and policy programs. Andrea currently serves as the past chair of the TCN Executive Committee, following her term as TCN chair during the 2016-2017 term. Thanks so much, Andrea, for joining us on this afternoon's webinar.
Thanks, Josh. Can you hear me okay?
Yes, we can hear you.
Perfect. Thank you. Well, thanks, everyone. I'm happy to be here. I'm going to move into how we in Minnesota decided to use the corrective statement. And I think that this is part of our situation analysis. Whenever we do a new campaign, we just kind of lifted this piece out. That after 20 years of litigation, big tobacco has been found in violation of federal law and ordered to make these corrective statements. But when you look at their corrective statements, and I think as Desmond described at the front end of this presentation, we really came to the conclusion that they don't go far enough. And not only did we want to make sure all Minnesotans, or as many Minnesotans as possible, knew about the fact that they had to make those corrective statements, we thought it was fair to provide some of our commentary as well. So we developed, we do paid, earned, and owned media around this. I'm going to talk specifically about the paid media campaign that we've developed to amplify and critique Big Tobacco's court-ordered campaign. Again, it's to expand awareness and engagement. We have a number of grantees throughout the state who are using this as well. But we, of course, hope it builds support for policy change and drives traffic to our various websites that are very educational and increases social engagement around this topic. So our media plan overview, we decided to dedicate $100,000 of our media budget to this, having 2 flights, and you can see the dates there. The geography was statewide. Our audience is Minnesota adults with an emphasis on what we call connectors, those who are more socially engaged, and we identify those folks through various tools like MRI and Simmons, in terms of if they've, if they're attending community meetings or if they've voted recently, or there's some other kind of information that we use to pull and hone in on what we consider a connector audience. Also, to make sure that we're reaching our diverse audiences who have been targeted by the industry so heavily, and legislators and policymakers. And excuse me, for the paid side, again, we're using print, paid social, and digital displays. So just in terms of what some of the creative looks like, we've gone with a fairly simple design. We're using words from the corrective statements themselves, and then making a play off of kind of the red pen editing that we're probably all familiar with, or redlining on the computer. So this is the Star Tribune, which is our largest circulation paper in Minnesota. It is not one of the print outlets that is being used in the campaign, but nonetheless, it's one of our biggest tools on reaching Minnesotans. And you can see, we've edited kind of their copy with ours. So it's not easy to quit because we intentionally make it harder to quit. This is print, and it might be kind of small on your screen. I'm going to give you a website at the end where you can see all of this creative. But us, along with our partners, just took one of their print ads and, again, edited it with, I guess what we think is more direct and impactful language that really characterizes what the industry was really up to for all of those years. On the social media side, we're using a number of our social media channels. This is Minnesotans for Smoke-Free Gen, the Twitter handle here, and we've got Facebook. We have, of course, complementary. The nice thing about social media is we can use ClearWay Minnesota's to amplify this, but all of our coalition partners can use their own as well. But you can see, how this would be animated, either static or animated. I'm not sure if this will work. I'm going to try to click on this to see if you can see how it would pop up as a video. Nope, I don't think that's going to work. So again, with the website, here it is, bigtobaccolied.com is the website we created that has all of the creative assets that we put into this campaign so far. We'll be starting another flight, and as I think the other presenters mentioned, the industry has to roll these out over a period of time, and television will be playing for a year, and there are maybe some other aspects of this that we can all take advantage of that are still being litigated at some point. But, for us, we timed it up with the launch of that first ads that the industry put out, and we were on for a few weeks there, and now we'll start a second round. And again, we're continuing to pitch on the earned media side as well as use our own mechanisms as well. So that's our campaign in Minnesota, and the way that we are trying to really amplify the corrective statements that so many people worked so hard on over the years to finally, I guess, get out there in the marketplace, even though the tobacco industry was fighting them tooth and nail along the way. So thank you.
Terrific. Thanks so much, Andrea, for your overview of the Big Tobacco Lied campaign, and thanks again to all of our speakers for joining us this afternoon. So we do have ample time remaining this afternoon for questions and answers, and so I'll be moderating today's Q&A session by directing inquiries from the chat box to today's presenters. As a reminder for everyone joining us, phone and computer microphones are muted for this afternoon's webinar, so if you have a question you'd like to ask, if you have a follow-up question or a clarifying question based on the responses that we'll be getting from webinar speakers, please feel free to use the chat box at any time throughout the Q&A as we answer questions. I'll start off with a logistics question that I've been seeing in the chat box. Our slides and recording of this afternoon's webinar are going to be available. Yes, we will be following up via email this week with those materials, and then also we'll be posting a recording and slides on the Tobacco Control Network resources page and also the ASTO Tobacco Resources webpage. And I'll, during concluding remarks, give everyone an opportunity to see how they can get to those pages to see those resources available there. So going to Q&A, we have a question in the chat box. Will there be an ad during the Super Bowl? Becky, are you able to provide any insight? Do you know if there's going to be anything planned for the Super Bowl?
I haven't heard either way, but I would highly, highly doubt it. Plus, is that during prime time? I guess part of it would be, but I will let you all know if I hear any differently, but I do not think that's in the plan.
This is Desmond. Correct me if I'm wrong, Becky, but I think the ads run something like Monday through Thursday,
right.
intentionally to avoid the weekends. Yeah.
On Sunday. So no, they will not. That would be a great opportunity, but unfortunately no.
If only. We'll consider that a missed opportunity. Desmond, follow-up question for you on this regard. Was there any negotiation between the tobacco companies and the U.S. federal government about the specific timing and the days of the week of these television advertisements? Was that part of the legal negotiations there?
Well, I should say first there's been negotiations and orders and briefs for years on this, and eventually the judge sent the parties to a mediator to try to work out some of the details, and I think that probably accelerated things a little bit. But as I said earlier, they're still litigating some of the other media outlets. But I think eventually what they come out with, and what you find in the orders is, in order to provide for, you can get down as specific as this ad will run on this day at this time, but then you sort of have to dictate every single ad for the entire year or however long it goes. So the ads are something like there must be this many ads in this amount of time, this many weeks, and it has to be on, as Becky said, it has to be on one of the major networks or else a large enough share. And so yeah, there's not a ton of specificity, because the tobacco companies have to actually go to the networks and buy the ad time as any other advertiser would. So if you specified it has to be on this date at this time, and that the network's already sold that ad, you'd kind of be out of luck. So to provide a little bit of flexibility to make sure that they could get in the amount of ads that they had, there's not the level of specificity where we know exactly when the ads will run, 6 months from now.
Terrific, Desmond. Yeah, thanks for that insight. There's another question that I think Becky or Desmond might be best situated to answer. Is there a list available of African American and Spanish language newspapers where the advertisements are running?
Yeah, we do have that on that resource page that I linked to. So there's a list of all of the papers. So it doesn't. I mean, there's not like a separate list of Spanish papers and African American papers. It's all on one list.
Terrific. Thanks, Becky. Yeah, that'll probably be a helpful resource. Another question we have, we'll turn this over to Andrea. Has there been any pushback, Andrea, on the ClearWay Minnesota ads? And what kind of feedback have you seen about the Big Tobacco Lied campaign?
Thanks, Josh. We have, well, let's see. We kind of expect a normal amount of pushback on any campaign that we do, whether it's only on the digital and social side or if it's on the television side. Even before social media, that was the case, where we would get comments that certainly weren't always positive. I think social media can sometimes amplify that. But with this campaign, we've not received any more than kind of the normal chatter in terms of the negative side or pushback. There's also been, I think it's been a motivating factor for, we have a coalition with well over 50 organizations, and I think it's, just seeing, learning more about this case and, what we can do to kind of extend information about it has been very much a motivating factor for members of our coalition, and they've all been very engaged on the social side in terms of helping to amplify the message. So nothing more than the usual, and we've had, of course, a lot of positive comments as well, and a number of connectors and policymakers who have called things out for us on the positive side as well.
Terrific. Thanks so much, Andrea. We have a question here that I will pose to Doug. Doug, you made mention that the tobacco companies deceive not only the general public but also lawmakers. So based on your findings in Oklahoma, how do you recommend that tobacco control stakeholders garner support of lawmakers for tobacco control policy in light of these corrective statements?
I think the first step, again, is just for them to be made aware of the racketeering verdict leading to the corrective statements. Our experience here has been that it is very compelling. It certainly undermines the tobacco industry's credibility at the Capitol. I think that we're not alone among states in that we've had a tremendous amount of power exerted by tobacco industry lobbyists at the state Capitol. Wish we had more power in our coalition. We're getting better, but the tobacco industry has been very strong, and it is a fact that they get their instructions from the tobacco companies, and so if the credibility of the information is undermined, I think that many lawmakers will take that into consideration as they weigh their decisions.
Thanks, Doug. Yeah, it does seem like it's a constant uphill battle for the tobacco control folks, but yet here we have a key leverage opportunity. So it seems like spreading awareness is a good first step to get not only public buy-in, but also that of legislators as well. We have another question here that I'd like to pose to Andrea. Andrea, what has engagement been like for the social media portion of the Big Tobacco Lied campaign? And if you're able to share anything on this, how did you settle on a budget amount for the campaign?
Oh, those are good questions. Let me start with the second one first. We have a fairly robust education and media campaign budget every year that focuses on promoting quitting and our quit plan services, but also is focused on changing attitudes and opinions about, tobacco use in general. And one of the kind of the threads of that has been to ensure that we've got a fairly steady drumbeat of exposing the tobacco industry for kind of the predatory marketing and unethical practices that they conduct. So, we had known for many years that this case was moving forward, and we always thought we would do something with it. Doug talked to me this summer to tell me that it was probably something would probably be published this fall, and although he was quite credible on that, even though I had heard it before, and so we started to think about what we could do. And just for us, because this is kind of we think about this corrective statements campaign as one part of a broader campaign to change attitudes and opinions. And so we always leave some room in our budget, which is a multi-million-dollar budget, to take advantage of opportunities, really good opportunities like this one that come along. So in this case, we decided for kind of the duration that it would make sense, and for the, we wanted to keep the creative fairly simple so that wouldn't become overwhelming on the budgeting side, and every media market's going to be different. I mean, obviously our costs reflect our own, but, $100,000, allowed us to do 2 flights, not do any television, of course, but to do 2 flights with some assets that could be used in lots of different ways. We would get a lot of bang for our buck on the production side, as well as be able to generate, a presence. And I don't kind of have those numbers in front of me, but if it's something someone would like to talk about further, you can feel free to contact me. I'm sorry, I forgot to put my contact information up there, but Josh, maybe if you're the one that's going to send out the presentation, feel free to add my email address, and I'm happy to dig in just a bit more if anyone wants to talk further.
Sure, Andrea, happy to do that. That'll be no problem, and thanks for elaborating in detail on that. Next question is something that I think I'll pose to the group round robin format, starting with Desmond. The question here is, which element of the corrective statements, content, and legal background do you think is most important to highlight to raise awareness of tobacco industry deception? Desmond, any thoughts on that?
That's a really good question. I like that question a lot. And it's really hard to answer also. I think if in order to make the message most effective, understanding that this is not really my area of subject matter expertise, but I think it's really important that the industry, the industry fought really hard to make sure that the language, the preamble about deception and the fact that these statements are true and they haven't told the truth in the past, the fact that the industry puts so much resources into making that not happen tells you how important it is that they don't want that information out there. So I think what you see from ClearWay and the folks here, and I think it plays out in a lot of the data that Doug showed too, is that the important thing that's missing from the corrective statements is that they're making those statements because they're being forced to, and they're being forced to because they lied about it. So highlighting the fact that they've lied and these are the statements that are true, that to me I think is the most important part.
Thank you, Desmond, and we certainly value and appreciate your thoughts with the legal expertise, so please don't sell yourself short. Becky, do you have anything to add on that point, on what the most important parts of the corrective statements are to highlight?
No, I think that's true, and like I said, especially in light of lots of companies now trying to paint themselves as having totally changed, and they have done that so many times in the past while this case was going on, and and said that they were not, they were changing for the better, they were no longer going to target kids or whatever, whatever the message may be, and that was not actually the case. So I think playing up the fact that these tobacco companies have had such a long history of vehemently denying the truth and lying is a really important point.
Terrific. Thanks, Becky. Doug, same question to you in reference to your findings based on your research in Oklahoma. Can you remind us on which elements of the corrective statements do you think are most important to promote at the state level? Perhaps which ones had the lowest public awareness based on your research?
Well, I think overall it's just important to look at the general credibility of the industry being very low because of all these years of deception. And, it seems like the biggest opportunity may be around policy. We know that's our biggest opportunity in tobacco control in general, and maybe it can be a really big opportunity with the corrective statements coming out as a catalyst to be able to talk about the tobacco companies' deception and influences on policy in the past, and that they're attempting to provide information to lawmakers today that is likely not to be trusted. So one of the sets of the corrective statements, of course, is directly relevant to the clean indoor air policy area. The fifth set dealing with the truth around the hazards of secondhand smoke, and the full-page newspaper ad for that particular corrective statement, and those bullet point facts on secondhand smoke, will be running on March 4th. And listening in to some information from the Campaign for Tobacco-Free Kids recently, I was reminded that's really a great opportunity, and the Americans for Non-Smokers' Rights also has really been pointing out that March 4th, that Sunday, maybe the following week, would be a great opportunity to highlight that particular area of deception the industry has engaged in, and relevant to clean indoor air laws, of course, that we know are not yet in place for 100% smoke-free in about half of the states.
Terrific, Doug. Yeah, thanks for that insight there. And it seems like there's a month or two of planning opportunity to get something prepared for that final set of corrective statements. So appreciate your insight there. Andrea, same question to you to round us up here. Based on what you've seen in Minnesota, have you found that any particular ad or any particular highlighting of the corrective statements content has been most successful in Minnesota?
Sure. I'll just round out with maybe 2 points. We really took our cues from Doug's research, which was very specific to the corrective statements and how people were perceiving the industry relative to that content. And then, we do our own public opinion surveying, and although we haven't surveyed around this particular topic, we do survey a lot around, trust and attitudes around the tobacco industry. So combining those two things, really led to the formation of the campaign that I shared. And I think it's really the points that the previous three speakers highlighted in terms of it's a fresh way to and a current way to highlight, this ongoing deceit, the ongoing deception, that they just simply will fight tooth and nail to make sure that people don't know about these things, and that we want to make sure people do know so they can make informed choices.
Terrific. Thanks, Andrea. And it looks like we do have time for one final question. So in looking at the chat box, Andrea, I'll be keeping this one with you. And you might have touched upon this a little bit just now, but how are you measuring successes and outcomes with the Big Tobacco Lied campaign in Minnesota?
Yeah, that's a great question. So with that particular campaign, we're really just focused on the process side. So looking at how social, how if people are clicking through to the website, visits to the website, shares, trying to think of some of the other ways that we have. But those are, it's really kind of what we can measure with the data that we would normally get back. We're not doing any type of special evaluation about, that looks at pre-post and, kind of the power of this campaign to change attitudes. Again, this campaign resides in a broader campaign for us, so it's kind of one message stream of a broader campaign that we look at, and there we look at key measures of changing attitudes and openness to continuing to do more in our state to reduce the harm of tobacco. We have probably 5 or 7 key indicators that we look at relative to the effectiveness of our media overall, but nothing that's going to be so specific to this campaign except for those process measures, which I think are valid, but they're, I can't. I think they're valid, but I can't say, I won't be able to talk about, this has changed, the minds of X percent of people or things like that.
Sure, understood. Thank you, Andrea, though, for elaborating on that, some helpful detail there. So looking at the time, this does wrap up our Q&A portion for this afternoon. So thanks to all the participants for your questions, and thanks again for the webinar speakers joining us for your thoughtful and detailed responses. I hope the Q&A was helpful in shedding additional light on how states, territories, and other tobacco control stakeholders can capitalize on this unique opportunity, these tobacco industry corrective statements that are being distributed through TV, through newspapers, and perhaps through other avenues as well. So as we conclude this afternoon, I'll provide a brief overview of the tobacco resources available on both the TCN and the ASTO website, starting here with the TCN website, www.tobaccocontrolnetwork.org. The TCN website offers ample resources designed specifically for state and territorial tobacco control programs and their partners. This includes an archive of TCN's twice-monthly newsletter, a directory of all TCN members across the states and territories in the U.S., and also the 2016 Policy Recommendations document, which is a comprehensive overview of tobacco control policy best practices that can be enacted at the state and local levels. TCN is always making new resources available on the TCN website and also through that twice each month newsletter. For example, TCN and ASTO are currently collaborating on a tobacco and health equity blog series featuring state examples and expert opinions on how states can work towards health equity through tobacco control programs and policies. In addition, TCN continues to post more podcasts that take a brief 20 to 30 minute look at emerging topics of interest in tobacco control. If you would like to join the TCN mailing list, or if you have any questions about the resources available on the TCN website as you go exploring, please don't hesitate to reach out to us at tcn@asto.org. TCN also invites everybody to keep an eye out for the TCN member packet, which is a forthcoming resource that will provide a comprehensive overview of the Tobacco Control Network, what it does, and how it can support state and territorial tobacco control programs in accomplishing their tobacco control goals. The member packet will be circulated through the TCN mailing list in February and will also be available in a forthcoming issue of TCN News in February. The ASTO website also contains a plethora of tobacco control resources for states and territories, including a wide variety of written reports, such as issue briefs and case studies. You'll also find recordings of past ASTO tobacco control webinars. And you'll also find the ASTO e-cigarette library, which is a searchable database which is regularly updated to include the latest research and partner resources on e-cigarettes. ASTO's tobacco control homepage is available there through the link at the bottom of your screen. ASTO's newest tobacco resource is an interactive infographic that explores how state health departments can address tobacco-related disparities in an effort to promote health equity. ASTO launched this resource collaboratively with the 8 CDC-funded national networks that work with populations experiencing disproportionate death and disease burdens resulting from tobacco use. ASTO invites everyone to view this interactive infographic through the ASTO website or the direct link available at the bottom of your screen to gain an improved understanding of how tobacco of tobacco-related disparities in the United States. Finally, ASTO always invites everyone on the call to share your state success stories with ASTO. We're always looking to interview states and territories on their strong tobacco control work to share those successes with our networks and extended audiences. As you know, peer-to-peer learning is very powerful, and so we always welcome the opportunity to facilitate this information sharing. So if your state is doing something amazing in the area of tobacco prevention and control, and I'm sure that applies to everyone listening in, please don't hesitate to get in touch directly with me. My email is there, jbarry@asto.org. As a wrap-up, I want to let everyone know that as we conclude here, you'll be directed to a survey at the conclusion of the webinar, and a link to the survey will also be made available to you via follow-up email. We ask that you take a couple quick minutes to complete the survey, as it provides TCN with invaluable input on how we can improve future webinars and virtual learning opportunities. And so with that, I'm happy to conclude today's webinar. I want to once again thank Desmond Jenson, Becky Wexler, Doug Matheny, and Andrea Mowery for joining me this afternoon. And I would also like to thank everyone from ASTO and from the Tobacco Control Network Executive Committee who made today's webinar possible. A recording of today's webinar, again, will be sent to you via email this week along with webinar slides, and then we will also be making those resources available on the ASTO and TCN websites. Again, any inquiries at all about the Tobacco Control Network can be sent to us through that email on your screen, tcn@asto.org. Thanks again, everyone, and please enjoy the rest of your day.